So now it is my pleasure to introduce our rural voices. And the way this is going to work is that we're going to show the videos of our three rural voices, and then we'll do some Q&A of them because they're all attending this webinar today as well. So if you have questions that you would like to direct to these presenters or questions about rural communities, please put those in the chat so that we can address those later. So on our rural communities voices, we have former Senator Crowder, who represented Southern Colorado, quite a large swath of counties in Southern Colorado. We have Niki Delson from Carbondale and Marilyn Humphrey from Montrose. They are going to share their efforts and their experiences on behalf of older Coloradans in their communities. So without further ado, we'll ask Chris to bring up their videos.
Hey, I'm Niki Delson. I'm the co-chair of the Carbondale Age-Friendly Community Initiative. We joined together to form an organization that would encourage the town to become an age-friendly community, and we did that back in 2019. The goal was for older adults to have a voice, to be visible, vocal, and contributing to all aspects of community life, civic, social, building the infrastructure. Wherever anybody showed up, we wanted to make sure that older adults weren't a footnote in planning. So in order to become an age-friendly community, you really need the Board of Trustees to say, yes, we will live into the aspiration of becoming an age-friendly community. It's not like you get a stamp that says, okay, now you're age-friendly. It really is a commitment of all community leaders to live into the vision. I think because we're a rural community, I think that that is so important because rural communities have that. You're small and people know each other, and older adults are a vital force in all volunteer work in the communities. And so in the beginning, all we did was forge relationships and talk with people about how to grow the idea of an age-friendly community. I think when you talk about older Coloradans, that people need to realize that there are different levels of being older. So there's young older, you become like when you get to retire, so in your early 60s and then in your 70s and 80s on up. And what the needs of each population is different because our health challenges are different, our social network is different, our relationships are different. And so it's hard to just say, what are the needs of older Coloradans? But if I try and conceptualize that into, like an umbrella to cover it all, I think I would say being relevant. That can mean different things. So it can mean being relevant to your family, and I'm thinking in terms of COVID, how that has really changed our capacity to do what makes us feel relevant. So being relevant to your children, being relevant to your grandchildren, being relevant in your community. And for those of us on the organizing steering committee for CAFGE, it's being able to contribute back this wealth of knowledge that we've accumulated, the resources that we could bring to the table in order for people to think of older adults not as just people in need, but as a resource to a community that comes from a wealth of experience. Carbondale is a magnificent town with wonderful trails and wonderful places to walk. and it's a mountain town, and there is, through the central core of the town, a multimodal street. As the town has grown, it has become more and more dangerous for pedestrians and for cyclists. Carbondale has a system of what's called priority corridors. We took the information on this one particular corridor, which we thought was very dangerous for older, well, for everybody. The Board of Trustees, after not addressing this for at least, I would think 20 years that it has been done, has now moved budget money in the tune of $90,000 for the consultant and $500,000 over the next 2 years to address that multimodal corridor and change the design. As a group, our passion is making the town safe for older adults to walk in, and those of us who still cycle get anywhere in town safely. And that has been our passion since we formed, and having accomplished this, I think, was really incredible. We're still in the process. The design will be finalized in March.
My name is Larry Crowder, former State Senator Larry Crowder. I was actually term limited January 13th when they swore the new senator in. I'm a Republican which represented Southern Colorado, South Central and Southeastern. There were 16 counties in all, from the San Luis Valley all the way to the Kansas border. You know, it's a great territory, and it was quite an experience the last 8 years. And I would actually recommend anybody trying this, because it is an experience on how state government and local government is run. So with that said, I appreciate the ability to come and talk to you briefly about the agent. The experience that I've had, the legislative over the last 8 years is pretty vast. So there was a lot of different subject matters in which we dealt with. You know, I will tell you that basically I'm one of the senators or one of the legislators who actually created the Colorado Commission on Aging. So it was an important move, because what we have to do is look out for the future of older Coloradans in Colorado. So I felt that was a just commission, and so far it has proved to be very reliable as well as informative on the needs of what we can expect because of the rising population of the older population. We try to create a situation where telehealth, you know, would become more and more reliable, and people would turn to that instead of actually going to a doctor. I've used telehealth myself. I'm very, very confident in it, and you know, I was glad to be a part of that telehealth. And you will see more of this coming out as we go along. I run a lot of veterans bills. I served on Health and Human Services Committee my entire 8 years, as well as local government. So I was very involved in a lot of the health decisions made in the state. I'm fifth generation Southern Colorado. You know, I understand the area, and I understand, you know, the commitment that the older generation have made to this country. And I do not believe that they should be treated at any point in time in their life as second-class citizens. But we need to look out for them. We need to make sure in a changing world that they are taken care of. In rural Colorado, how expansive it is, you know, we're talking hundreds of miles across the state. So I think transportation is right up there amongst the biggest. You know, we have towns that are 50, 60 miles apart, and some towns have no medical, either clinics or medical facilities whatsoever. I did mention telehealth a while ago, but once the telehealth is done, you know, there's times when the medical people need to see you. You know, they need to see you in person. So I think transportation continues to be a problem that we need to, you know, make sure that and be aware of. The facilitation of this is put in place. I might comment too. You have to realize too, a lot of these people in nursing homes right now, the saddest thing that I've experienced is their isolation due to COVID. I had an uncle myself that was in a nursing home, and the only way I could visit him was through the window which I stood outside, and that was terrible. Nursing home patients have probably suffered far more than the rest of us. So my heart goes out to them. As a multi-generational Southern Colorado, the more time went on, the more I admired the people in the district and for their demeanor, for their stalwartness. And I really can't take credit for anything because there's nothing that we can do in the legislation that we do alone. It takes a lot of people to get it done. Our job as legislators was to assist people in making their lives better. And this is what I feel like we did. I don't think that I did anything special. I think this is what we as all legislators should be looking at. I think the Commission on Aging has done a remarkable job, and they will continue to do so.
My name's Marilyn Humphrey. I've been with the Time Bank of the Rockies since 2012, and I volunteer with the Golden Circle Seniors at the Montrose Pavilion Senior Center. The Senior Center, the Golden Circle, facilitates all the programs at the Senior Center, all the meals and all the activities there. Working with Cynthia Harwood, she is probably one of the most passionate people about keeping community connection and what people need and how to connect them with the volunteers they need that I have ever met. This city is all volunteers. There's 200 people that volunteer at the hospital, Montrose Memorial Hospital. The library is run completely on volunteers. The food bank and sharing ministries is all volunteer. When you volunteer, you put your volunteer time into the time bank. And then when you want to spend your time, you put in a request for help with your garden or your house or computer problems. And the volunteer that comes out to help you with that gets to add time to his bank. That's why it's so helpful for this community and especially the seniors. The seniors at the senior center totally run on volunteers because all the meals from taking the money to not preparing the meals, but to serving them and cleaning up, all the programs, all the exercise programs and bingo and dance programs are run by volunteers. The biggest problem right now is that we have to have more grants and more city involvement with our meal programs. At the senior center, we had 24 volunteers driving and serving homebound lunches under a program set up by Carol McDermott called Adopt a Senior. That grant went away and now is serviced by VOA that serves frozen lunches twice a month. The grants are going away. Right at the moment, we have a really good grant offered by, it's a COVID grant by Region 10. It's called Soups On. And that grant got enough food together for Backstreet Bagels to prepare hot soup every day delivered by the volunteer drivers to not just homebound, but seniors at home that are staying at home, getting a hot meal. What that also gives people is connection with a human being every day. This is becoming more and more and more important than even the nutrition. People are dying not just of lack of nourishment, but they need connection and they need purpose. That grant, I think, is gone on twice now and is going to be over the end of this month. So those are the things we're looking for is more grant money. We've lost 3 food programs here. the passion comes from supporting the community. You know, it's the community values here are real strong on that volunteerism, and when you can be a program that actually gives back something of value to people that have given of their time, that's a valuable commodity. It's a very big value.
Hello,
Okay.
Kelly.
Yeah.
Okay.
Thank you, presenters. And I am assuming you're on the call today. And I guess I would ask Rich. Rich, are you seeing any of our legislators or their staff on the meeting?
Yes, I believe we are. And so if it's time to ask for comments and discussion, I will go ahead. Are we ready to do that, Kelly?
Yeah, we would love to hear what the legislators' responses are to the needs that they heard, and also their thoughts about the needs of older Coloradans.
All right, so I'll start and I'll ask Bob to also monitor to see who I miss. I think I see Representative Barbara McLaughlin on there, and I think Bob said he saw um, Representative Mary Young as well. There may be others, but if Representative McLaughlin is available and ready, I would ask her to unmute herself and see if she would like to make a few comments responding to what you just suggested.
Hey, here I am. Thank
There
you very
you
much.
are.
Yeah, hello. Well, this is my retirement job as a legislator. I decided to run after I retired from work. So we're going into the second stage of working and staying around. Really interesting comments. I think that they're statewide comments. In my district, we have a lot of, there's a shortage of home health care right now. And finding home health care during a pandemic is very stressful. I think people want to make sure that the person coming into their home has not been to a dozen other homes where nobody wore a mask, and then they come into your home and decide not to wear a mask. And I guess I say this because my husband right now is needing home health care. So right in the other room here, we have people taking care of him right now. And it was really hard to find. And there's ads in the paper, we really need you. And some of the services that we would pay, you pay a lot of money to them, but the actual worker is getting just minimum wage for coming in and having my husband's life in his hands. And so we decided to go rogue and just hire one at a time on our own and pay them what we think they're worth. So so that's been working out pretty well. Telehealth has been really wonderful in my community. I know a lot of people are really getting that. And I think the whole, I think it was Senator Crowder talking about the nursing homes where you have to go and look in the windows. And we've been trying to have organize high school bands to go to the windows so that everybody can kind of hear music while they're in there. But I think that whole sense of reaching out and being with someone and having someone touch you that doesn't have plastic gloves on, and having someone give you a hug, we start losing that. And I think we have to be very, very aware of the mental health as well as the physical health of our the older citizens who are in nursing homes right now. It's lonely and it's hard, and the nurses are the only ones that talk to you, and they have a mask on and they're all covered up. There's no, I think we're trying to, I guess we are losing some of that, the stuff that we just never knew was so important, I think, was human contact.
So
Representative, this is Bob Rucker.
Mhm.
Good morning. Thanks for joining us. So could you talk a little bit about what your district covers? I mean, not everyone on here will knows that.
Sure.
And then secondly, we heard some conversation earlier regarding volunteering, a lot about volunteering, especially in Montrose, and then
Yes.
the whole issue of the age-friendly communities that Carbondale is involved in. Can you comment on those two things regarding your particular district?
Yeah, I'd be happy to. We have, I live in Durango and I represent 6 counties in Southwest Colorado. I don't go as far east or far west, I guess, as Montrose and Montezuma, but I kind of go north. So I have Archuleta, where Pagosa Springs is, La Plata with Durango, Silverton area, Ouray, Hinsdale, Lake City, which is the most isolated county in America, and Gunnison County. So it's the most beautiful part of the state. Really fun to drive in when there's snow, I will say that. A little terrifying. We have the San Juan Basin Area Agency on Aging here, and they've done a great job getting meals out to groups of people. It used to be groups, and now it's a little more one at a time or socially distanced, of course. So they're working really hard, but I love the ideas that have come out of Montrose, and I think it was Carbondale. I think every community needs to find out what fits them best. We have the 55 Plus Center here in Durango, and it's been closed a lot, of course, because of COVID, but it has been a godsend for people. They have buses that go there, and it's just for people who, it's just the people who kind of need that one-on-one experience. And they have been doing some programs there to reach out to other people, but it's not nearly as organized as it seems that Montrose is. So we're jealous.
Okay, thank you very much. Reg, Kelly, do you have any questions for the representative?
No, I'm just glad that she was able to make it. I know she has a busy schedule today, as legislators often do, and so we definitely just appreciate you making the time to join us and listen and give us your comments.
Well, it's my pleasure. What I will say I would like to see more of, I'm a retired high school teacher. Now I'm chair of the education department or committee, but I would love to see, once we're on the other side of all of this, more interaction between our senior citizens and our youth. I think both can learn from each other. And I think some people have, they have grandparents and that's the only older people they know. And maybe their grandparents live on the other side of the country, so they don't really know them. And I think we need to share the wisdom of the generations with each other. So I'm hoping we can kind of get back to that a little bit more.
That's a great idea. We will follow up with you.
All right, please do. And I do have to go to another meeting, but thank you very, very much for cutting this a little short for me and letting me join in to you. Okay, thank you.
Thank you.
Let's see. I think we should we continue, Bob?
Well, Rich, are there any?
I do see.
legislators?
Well, I see one legislator for sure, Representative Mary Young. Maybe we should go ahead and ask her if she would like to speak now or if she wants to wait till later. And then I also see a couple of aides for certain legislators, which we could call out later, but let's see if Representative Young would like to speak.
Well, hello, everyone. And I certainly would love the opportunity to speak because I too probably have to run off to another
Great.
meeting before
Sure.
we get done. Thank you, all of you, for all of your work. I consistently say I've failed at retirement more than once. I represent House District 50, which is Greeley, Evans, and Garden City. I was working in a school district, retired as a school psychologist, and 3 days later got a phone call asking me to consider employment again, which I did, and continued that for over a decade. And then this opportunity came about to be a legislator, so I continue to fail at retirement. Um, I was interested to hear many of the comments that the previous speakers addressed, because it certainly mirrored what I experienced as a legislator um, when the pandemic began and as it continues. First of all, our Weld County area on aging does a wonderful, the agency on aging does a wonderful job. And I did get phone calls as people made that transition from getting in-person meals to having home delivery. And we saw all the issues that transitions impacted individuals who fit in the profile of an older Coloradoan. And I also like to address of volunteerism. This is an area too that is heavily depends on volunteerism. And I don't know what it was like for all of you at the beginning of the pandemic, or even as it went on. I started to feel what was some reverse ageism, that if you were an individual over a certain age, we started to see this description of us as needing to be taken care of. And certainly some of us are in that position, but it started to concern me that we were going to see a regression on how people saw aging Coloradoans in their vitality. And many of my friends who are in the 70 plus category continued to volunteer during the pandemic at the Weld Food Bank and with their churches and outreach in many different ways. So those are some of the issues that are close to me. And the issue, I certainly agree with Senator Crowder about all the issues around nursing, skilled nursing, assisted living facilities, and the fact that we really, families are continue to have difficulty interacting with their families. And I think, as Representative McLaughlin said, we have to evaluate this as we move forward, and the impact on mental health and overall vitality when you're not able to have those continued relationships. As many have said, interaction between generations is so important. And I've, as an educator, I've participated numerous times when the schools I was working in would interact with skilled nursing facilities and assisted living. And unfortunately, that has definitely been a problem under the current pandemic conditions. So these are things that we need to circle back after all of this is over and decide really going forward, if we're hopefully not in this situation again, but unfortunately they're predicting we could be in this situation again, that we have responses that addresses the health of the whole person, especially those in isolated facilities such as skilled nursing and assisted living.
That's great. Let's see. I gotta make sure, okay, I'm unmuted. Thank you so much, Representative. We appreciate you making the time to join us and give us your comments. And we will look forward to working with you in the future as we all try to fail in retirement. So thank you very, very much.
So Rich, this is Kelly. I think
Yes.
it might be a good time to bring up our second panel of
Yes.
diverse community representatives. And once they've had a chance to share, we'll see if there's more opportunity for questions and answers. There's a few that I'm seeing, but let's make sure we get to hear from our diverse voices.
That's fine. Thanks.
So hi, my name is Sarah Beth Ford, and I work with the Denver Regional Council of Governments with the Aging and Disability Resource Center. I am proud to introduce our three speakers for our diverse communities portion of this presentation. I think you'll hear similarities to the people that we've heard from rural communities, and we can see a full picture of our older adults in all of our communities. Yolanda Gautier is representing the Center for African American Health. Lydia Dumas and Alejandra Lerma are representing the Denver Regional Council of Governments in the Latino Case Management Program, the Elder Refugee Program, and the Affordable Health Communities Program. I'm excited for them to tell you about the incredible work that they're doing and what they're hearing from their communities. Please type any questions that you have into the chat to be addressed at the end of the videos. Thank you.
I'm Yolanda Gautier, and I'm the Senior Living Health and Wellness Navigator for the Center for African American Health. The focus of the Center for African American Health has been, for over 20 years, a focus and commitment to improving the health and well-being of the African American community. So of course that would include our elders. We pride ourselves on being able to provide community-based, evidence-based disease prevention, disease management programs and events for our community. So one of the things that I would say is that the issues have exacerbated as a result of COVID-19, but for many in our community, they continue to have, of course, health disparities, which is being proven or highlighted by the impact of COVID-19, but additionally, food sourcing and resources, because many of those who live in our communities live in food deserts, and the need for housing, affordable housing, as well as access to housing. So one of the things that happens when individuals become older, if they have decided that they're going to downsize, it's being able to find something that is affordable and does not take all of the savings that they have worked years to be able to have. And then the other is for those who maybe they were renters all of their lives, and so they don't necessarily have the necessary finances to be able to do deposit first and last month's rent. We're also just looking at their health care as well as how they are being connected and to whom they are being connected within the community. So by that I mean, what does it mean for an elder who might be living alone? Are they connected to a senior recreation center? Are they connected to a senior living center? Do they have church connections? Do they have neighbors who check in on them? Especially if they don't have children who are able to do that, adult children who are able to do that. I just really feel like people should not ever have to leave their communities to get the resources that they need. I would say I am just passionate about the life excitement and activity that older Americans have. Now, of course, I'm getting there. I won't say how much longer it'll be until I consider myself an older Coloradan, but however, just the zeal and the zest that the individuals I've worked with approach things. As much as I probably didn't appreciate COVID-19 and its restrictions, I also found so much to be grateful for. And that I attribute to the people that I've worked with. Because they're just saying, we just need to stay in the moment and we need to work with the moment. So, one of my watch phrases for 2021 is that each day 2021 happens. We create it each day. And for me, not to sit up and try and plan out a whole year, because that may or may not happen the way I am planning it today. So, I definitely have gotten that from the community that I've been working with, but it is about me being able to provide what I can, where I am, where I stand for those who are in need of the services. And if I can't find it, I'm going to research until I can find somebody who can find it for me and help me with that. So I know I can't do it by myself, and I need everybody to help. So that would be one of the things I would say that I'm passionate about.
My name is Lydia Dumas. I work as optionist counsel for refugee and immigrant population and community resource navigator. Dr. Kak provides aging and disability resources. My specific program provides services to older adults and with disabilities from refugee and immigrant populations. The issue for refugee older adults in my community is the language barrier to obtaining citizenship. Let me brief or summarize a little bit about refugees' background. Refugees left their country due to political reasons and left their everything behind, like such as family member, loved ones, childhood memories, everything they left behind. All the refugees have been through difficult situations, and some face mental health issues, stigma, and trauma. When they come to the USA, it's difficult for them to obtain a citizenship because of the language barrier, their age, difficulty remembering things. Let me share a quote from my one of the refugee older adult. He had an appointment. I was helping him with the immigration attorney with one-on-one consultation. After he completed his appointment, he called me back. He called out my name, Lydia, my child, and I said yes. Am I going to end my life journey without knowing where I belong? He questions that to me, and for the moment I was quiet, and it breaks my heart. And I get it why he said that. They want to be part of this land because of the age. And he said, I'm too old to study English. And when I'm going to become a citizen. And some of them, they used to be doctors, teachers back home. But what are the options or ways to support them to pursue their dream to become citizens? How can we help them to feel like they have a home and then they can access other benefits as a citizens? I hope someone hears their voices. Imagine being in their shoes and you are in different country and you don't speak their language. How does this feel? And you don't know how to get connected with resources and you have to learn new things each time, the system, the role. I will let you answer that. Thank you so much. I'm proud that Dr. Card provides services to older adults because they are the ones who needs more support. And I'm happy to see refugee older adults when they integrate with different communities and become voters and support each other. And I have seen some of our clients, they volunteered in different organizations, and I felt so happy, and they have values, and they are providing services to each other and to friends and to the organization. So they have value, and that makes me happy seeing them in that way.
My name is Alejandra Lerma, and I am a case manager for the Latino community and refugees. I work for Dr. Cobb, Denver Regional Council of Government. My role is to help older adults of low income to get benefits, to get them medical care, dental, vision, social security, and everything else that they need. The focus is to be a strong support for those that have barriers and accessing the public benefits and all the resources that they need for lack of the language or their academic levels. So we are the strong bone to support them and to help them get better and improve their livelihood. The number one is medical care. Medical care is very limited, even to those that are legal residents. Immigration laws have prevented for them to get medical care. And I have cases that are, seniors that are in their 70s, 80s. A lot of them have been victims of COVID, and they have huge piles of medical bills. They cannot recover well because of the situation, but they don't have access to medical care. Their only care that they get is low income clinics that are very limited to what they can offer. It's a very sad situation for them, worrying about how they're going to pay those bills. And even without COVID, they were going through a lot of health issues. A lot of them want to work, but if they don't have the main thing that is medical coverage, they cannot support themselves and they live in a very bad situation. For example, Mr. Q, 84-year-old, he's a cancer terminal patient. He's just been like that for several years. The wife is under a lot of stress. They're legal residents. They have very low or minimal income because they don't have access to pensions with Social Security, and they don't have access to public benefits. It's very sad to see them how in poor shape they are. He has to have oxygen 24/7, and they're just borrow somebody's oxygen so he can, keep on going until the end of his life. So the wife is the main caregiver. She does everything for him, his total care. This is not acceptable, not here in the first world country, that we cannot even offer the main thing that is medical care to all these seniors that have been here 15, 20 years. And only because they don't have they have the sponsor situation in immigration, they don't qualify for nothing. It's lack of dignity for any human being. That's where my heart is right now, and that's the main thing we need to provide. I'm very proud of helping them change their lives and to get in a better place, like becoming a U.S. citizens, getting them in English classes, get them connected, teach them how to connect with resources that they can do. Um, so that's what we want, independent older adults, to avoid for them to go to nursing homes. As long as we keep on working together, I think we will have a better situation and healthier seniors because like I said, they want to work, But, you know, as long as we give them the opportunity to just be in the first world country that we are as human beings and as residents of the United States, I think that we can improve even the economy because they can bring more to the economy. So that's what I have to say.
So thank you so much to our presenters for sharing your work and the stories that you're hearing from your community. In all of the videos, I heard a lot of strength from older adults and a desire for showing those strengths through having a voice, being relevant, finding belonging and purpose, connecting, socializing, learning, volunteering, working, being with loved ones, sharing food, and accessing affordable transportation, healthcare, safety, and housing. Listening to the stories helps us see a full picture of Colorado and our vibrant older adult community. So I will go ahead and pass this back to Bob Brocker and Rich Mauro for discussion. Thank you.
Thank you, Sarah Beth. And this is Bob. And thanks again to all of the presenters. You did a fabulous job. So yeah, very much appreciated. And I heard some stories that were pretty upsetting. So I hope that we can continue to work through some of those things, and very much appreciate the work that Sarah Beth is doing, and in that regard, and Alejandra and Lydia, Yolanda, all good stuff. And so I think at this point we'd like to open up a little bit more discussion, and I think we'd like to start with, I think we have three legislator aides on here, and you know who you are. So if you would like to speak in reaction to anything you've heard, or about what your representative or senator is doing in regard to any of the issues that you've heard, we would like to hear about that. And then after you speak, we'd like to hear a little bit more from Senator Crowder about what he thinks can be done in the legislature. So folks, please.
And this is Rich. I'll just mention that so folks know, we're pleased that from what we can tell, we've had aides listening in for Representatives Dylan Roberts, Donald Valdez, and Kathy Kipp. Those are at least the ones that I've identified. And so you're welcome to, any one of you, to say a few words on behalf of your legislator. And if there's anyone else on that we've missed, we also invite you to. So let's see.
Hello, everyone. I'm Alex. I'm Rep. Roberts' legislative aide, and I know he was disappointed he couldn't join the call. He had a Judiciary Committee meeting at the same time. But one of his main issues this year, and one of the biggest pieces of legislation he'll be working on, is the Colorado public health care option. And so my heart really aches, and I know Rep. Roberts would feel the same way, hearing about how, especially during COVID and during the pandemic and one of the worst national health crises our country's ever faced, how aging Coloradans and Coloradans living in diverse communities don't have the appropriate access to healthcare. And I think that's something that the Colorado Public Option should definitely address and should be part of the conversation. So I'll definitely be relaying that information back to him and sharing your stories with him. So thanks so much for letting me listen in.
Yeah. Thanks, Alex. We appreciate it.
And we are recording all of this too. It'll be available for any legislator that would like to tune in later. Okay. And anyone else, Rich?
No, let's see. Not that I can see if they want to speak up.
Good morning. This is Andrea Oakes Hadamiel with Representative Donald Valdez, House District 62. I just wanted to say thank you all so much for hosting this morning. This has been extremely enlightening and also somewhat deeply concerning how we're perhaps really needing to support our senior communities better. Of course, Representative Valdez represents some of the very impoverished counties in Southern Colorado. And his main goal, of course, in these type of sessions is to get as much information as we can to make sure that we are then translating that into legislation that properly aligns with the needs of our seniors in rural Colorado. I think one of the things that was very heartening about this is the fact that due to connectivity, we're all able to reach out and come together a little bit more with these type of Zoom calls and disseminate information better than we would have in the past without having to travel. And I certainly hope this type of thing can continue so that we're making sure that we're getting resources to seniors that perhaps they didn't have access to before without that type of connectivity. So I know on our side, our seniors and our veterans are extremely near and dear to Representative Valdez's heart and their concerns, especially in rural Colorado, where the access to medical coverage is sometimes sparse, for sure. So I know that he is doing his best to make sure that he is staying mindful of those issues and working on them diligently. And we, of course, will take back this information and make sure that that is included as we move forward. So I thank you very much for this.
Great, thank you, Andrea. Did we have anyone else who wanted to comment?
Yes, hello, my name is Theresa Ho. I am Representative Niki Rix's aide. Representative Rix.
Okay, I know she had wanted to attend and she got called away. So thank you for joining us.
Yes, and of course, and it was a wonderful, I learned a lot, and so thank you so much for having me. Representative Rick sends her apologies for not being able to attend, but I've taken plenty of notes for her so that she will definitely be able to look at this after she gets back from her scheduling conflict. And I mean, I just also want to say that that these issues are not far away from Representative Rick's mind. I think right now, currently, her biggest priority when it comes to supporting aging Coloradans is ensuring that individuals have access to the COVID-19 vaccine. So we are actually hosting a pop-up vaccine clinic this weekend in order to provide the COVID vaccine for essential workers, but primarily for individuals that are over 65 and older. And Representative Ricks hopes that she will be able to continue having these clinics in her district, which is HD40, in order to keep providing protective services for older Coloradans. But I think this was an amazing, having this event, having this webinar has been amazing for my learning personally as well, to kind of hear more about also the need for support for mental health services for aging Coloradans and that need for connection, that need for community, and also the emphasis on telehealth as well. At the same time, I am a child of immigrants, and Representative Ricks herself is an immigrant. And so I think that she and I can, when it comes to wanting to be citizens, that really resonates with us, and that need for kind of more access, more assistance in order to allow older Coloradans that are aging and are refugees that assistance to become citizens themselves. That's a really important and meaningful thing. And so I will definitely be giving all these notes to her, and I'm sure she's going to love hearing about it.
Great, thank you, Theresa. We really appreciate your comments on this. Thank you.
Hey, Rich, one quick thing here. We are recording all of these, and so you will all have access to the recordings on the Colorado Senior Lobby website. probably by the end of this week. The person who's doing all this video editing, his name is Alex Gierkin, and he's with us today, listening in. And he's done a fabulous job of editing the recordings that you've seen, and he will do an equally fabulous job in recording and editing this and getting it out there for everybody to see. So you who are aides can provide that access to your legislators, and I hope you'll pass it along to all the other legislators as well, because there's some very important information here that every one of them needs to see. So. Okay, so thank you. Go ahead, Rich.
Yeah, Bob, thanks. I think I'm looking in the chat to see that I think I'm seeing that there's a aid for Representative Meg Freilich on.
That's me.
And that's you. So Marcia, right?
Yes.
Yeah, go ahead.
I'm Marcia Marshall, and I volunteer with Rep. Froelich, and there are 2 other older adults who work with me, and we try and keep track of older adult issues. And it's hard. I've been actually doing this work since I was a staffer in state legislature in Vermont in the 80s. And older adult issues are very difficult to bring to the forefront if it's outside of Medicare or the Older Americans Act. Currently, I'm still a member of the National Coalition on Mental Health and Aging, and this is a terrible time for older folks around their mental health. And there certainly is a dearth of resources, even if you live somewhere where there are lots of medical facilities, like the Denver suburbs. We live in the South Denver suburbs, Englewood, Littleton, Greenwood Village, Cherry Hill Village, and Sheridan. But even so, it's hard to find a mental health provider, and there are very few who specialize in older adults. So we're working on it. We're trying to keep an eye on things. I've only been here 3 years, and I'm still trying to learn more about Colorado and how it operates. It's very different from back east. Thank you.
Yes, it is. And you're welcome to reach out to any of us at any time for questions and ideas on those issues. And don't be surprised if we reach out to you.
Hey, Rich, this is Kelly.
Yeah, Kelly.
I just think it would be interesting to see if there's anyone on the meeting who is affiliated with a mental health resource who would care to share a few comments about access to mental health support.
Sure. Let me just real quick and see. I noticed Sydney Fisk was making a comment from, she's also an aide to Representative Valdez. And I didn't know if you wanted Sydney to speak or if you're good with the comment in the chat. Give her a chance a minute. She's staying.
Oh, yeah, I just wanted to express my gratitude for the unique perspectives I've heard. I'm 23, so I really don't get much exposure to these types of issues, especially as my first year as a legislative aide. So I think it's really important that young people are hearing this so they can get involved early on. And I especially appreciate the perspectives on refugees and people of color. Growing up in rural Colorado and representing rural Colorado with Rep. Valdez, that's not something you get to hear very much of in the mainstream. And I didn't realize all of the nuances that these intersectionalities, can face when it comes to challenges.
Great, thank you. We appreciate that. Go ahead, Kelly. You want to
Well, I'm just curious because as it's been pointed out, mental health during the pandemic is affecting all people and the isolation. But I was just hoping that maybe someone on the meeting could give people a sense of what some of the resources are that are available to folks. Amy Poley, any chance you could speak to that?
I also noticed that Tina Stacy, Jean Bogar, and we have a comment too from Jody Waterhouse too about what's going on at CU. So any of the three of you, if you'd like to speak.
Yeah.
Sure, I could say a few things, and anybody else who wants to jump in. Thank you, and thank you, Bob. I'm Jean Bogar, and I'm the Senior Care Specialist for Colorado Spirit Program with Jefferson Center. I put my information into the chat. I am working, as I mentioned, with Jefferson Center. We cover Jefferson, Gilpin, and Clear Creek counties. Colorado Spirit is a program initially funded. It's a crisis counseling program funded by FEMA grant and run through the Colorado Department of Health. We have programs throughout the whole state, and we are all in different phases of growing and work. Right now, most of the programs do have the senior care specialist, a child and youth family specialist, crisis counselors. We call them crisis counselors, but someone does not have to be in crisis, and information and referral coordinators. We present, we can do presentations with agencies, organizations, with residents, and with the staff. For example, we have had a couple of presentations with children at the schools, some on Zoom, some in person, and also with older adults. I have done a couple of groups with assisted livings and independent facilities, and it is with Zoom. So as we are getting more out into the community, we are hoping to be able to do it in person. So I can also talk to older adults one-on-one. The program is originally for people impacted by COVID. So that's everybody. And so what we can do is help with emotional issues. That's our main task. Anybody that is with anxiety, depression, stress, and their family members. And also remembering that there are some of us that, knowing that it's okay to be okay, it's also okay not to be okay. We have a lot of presentations. We can talk about coping skills, resiliency, wellness. We have several wellness presentations. I'm going to stop there, Bob, if you have questions or anything, or Tina or anyone else, or Yolanda that I've missed, go ahead and jump in.
Okay, thank you, Jean. So Kelly, I noticed quite a few comments in the chat from different organizations about mental health services that they provide as well.
Yeah.
So, go ahead, Kelly. I'll take it from here, please.
Well, I was just going to suggest to people that you be sure if mental health issues and access to support is important. We're seeing a lot of good resource references in the chat that you might want to check out.
Okay. One thing I'd like to do before we get any further along here, because I messed this up yesterday, is I'm going to put a link to an evaluation of this meeting in the chat. So I'll be doing that very soon. And hopefully folks will log into that and complete it.
It's really short. It
Yeah.
doesn't take long.
And that's very important to know. It's very short. It doesn't take long. Okay, go ahead, Kelly.
Well, I guess I'd just like to circle back to all of our presenters and see if you would care to respond to a question that I have, because it seemed like both presenters from both rural and diverse, you know, were had a lot of commonalities in spite of the fact that things are different in different parts of the state. So my question is for you at this point is, and do you have any suggestions for Colorado Senior Lobby or other state organizations in terms of how they can stay connected with you and your communities? What are your thoughts about that?
I would ask you to explain your question a little better. I didn't quite follow it.
Okay, I'll try it again. So we, as a statewide organization, Colorado Senior Lobby really wants to be representative of Coloradans all across the state. So curious to know your thoughts about how do we do that? How do we stay abreast and connected with folks around the state?
Well, I think, you know, in my opinion, you know, I think the one thing that has stood out for me on this meeting was basically the volunteerism. You know, it's almost as if every organization, you know, which is centralized throughout the state, you know, is concerned about their own community, which I can surely understand. But there's a lot of volunteerism that could actually help a lot of the problems in which persist right now. And, you know, the one that really struck me was the lady talking about the language barrier. You know, and I get it. It is a problem, but could you not mentor people with language inadequacies through volunteerism? You know, what has been spoken a lot of here is, you know, it comes down to monetary benefit from the state. Well, the state is broke right now. So what are the alternatives to additional money to fund some of these projects that are spoken about, such as housing and, you know, medical and whatnot? You know, I think the volunteerism should be a key factor on where we should head right now. And, you know, the lady in Montrose indicated they had 200 some volunteers. Why not have those volunteers statewide mentor these people with language skills? Why not have these same people mentor these people on how to get the medical care that's available? We have valley-wide throughout southern Colorado that specializes in immigrant care. So I'm a little bit perplexed. And you're right. There is a difference between rural Colorado and metro Colorado, and the biggest difference is we don't understand each other. And I cannot say on the medical issues, although Denver Health is one of the bigger providers for immigration up in Denver, but I don't know about Colorado Springs or Greeley and whatnot. But I think it's a lack of information. Possibly, you know, I might be mistaken, but I think there's a wealth of knowledge out there that we could actually help out quite a bit on this. And, you know, I'm not sure I'm answering your question, but this is kind of my take on it so far. With that said, thank you.
Thank you, Senator.
Go ahead.
Do any of the other presenters care to respond?
I could say something about, so I'm Niki Delson and from Age Friendly Carbondale. We are a small rural community in the mountains. there's a different culture in all of the communities that enables communities to move forward, reaching the needs of our specific populations. And in Carbondale, we are connected to 3 different counties, Garfield, Eagle, and Pitkin, and we all work together because we're so closely connected, and people who live in one county work in another. And we have forged a community, age-friendly, cross-county group that then looks at the needs of all of the community members up and down the valley. And so I think for Senior Lobby to be able to connect with those communities that are doing some unique things that are coming from the older population, not coming down from government, because we know that there's not that much money in government, and yet we're able to create resources and get resources to people just by older adults pulling together and creating linkages among the communities. So we're happy to provide that kind of information about what we've done here with other communities, and we have done that, gone into other counties to just share how older adults can be the can spearhead services and connections.
Thank you, Niki. It seems similar to what Senator Crowder is saying. It's about tapping people at the grassroots level.
I'd like to respond a little bit to what Senator Crowder was saying. I love the idea of learning from each other and utilizing volunteers. I do think that Alejandra and Lydia and our case managers are very, very well connected to all of the resources that are available. I think they're speaking to an experience that's still being felt in the community. And I think it's important for our representatives to hear that. And I'm happy to talk deeper about that. But I did just want to say that I think they are connecting their community members to everything that is currently available. So yeah, kind of just wanted to.
Well, I think I was more talking about what's not available. You know, if there's a specified problem as a language barrier and you have a multitude of volunteers, you know, you have a problem and a solution. Why not pull them together? The reality is on immigration, and you know, what we do in the state legislation is we treat everybody the same. We have different problems and different cultures. You know, the biggest problem with immigration is the federal government has not solved the problem, and I get that. But there's a lot that can be done to realize that, you know, we do have some specific cultural problems throughout the state, and we can identify those problems, but yet what we do is we tend to focus on having government solve the problem when the solutions are in place. And I'm talking about volunteerism on older Americans, that we could probably have an impact on this without government direction. Because I think you may agree with this, but if you have a language barrier, it creates other problems along the way. So maybe it's time to look at how to attack and somewhat solve the language problem within itself. And that would open up a lot of things right there for, because, you know, we all agree that we are a melting pot in this nation. And I realize that there are some political aspirations and issues that does stop us from looking at the bigger picture. And the bigger picture is what we consider to be the American dream for all people, irregardless of how they get there. And, you know, we have a legal course to follow, and I get that too. But in the interim, I think we can make this whole situation a little bit better by breaking down the language barrier, by mentoring to people who do have issues with that language. So and this is just a suggestion. I'm not advocating anything, you know, but I think if indeed we as older Americans are looking at what are the problems that face senior citizens, the language barrier is one of them, which we can overcome without the assistance of government.
What I'm hearing here is more volunteering is possible. More coalition building has been enabled, has actually been enabled through the COVID, because people have learned how to use Zoom, like all of you today. And so sounds like what we need is a driving force to gather and engage more people to volunteer for whatever they're passionate about, whether that might be teaching English to people who need to learn English, or teaching people about becoming a citizen, or teaching people about what resources are available to them, because you're right, many of them don't know what resources are available. So I'd like to turn this back over to Kelly, because this is kind of her part. So Kelly.
Well, we basically have 6 minutes, and I guess I'd just like to do a summary, and then we would like to share a 30-second video with folks about our event sponsor, Relay Colorado, before we all sign off. I want to reiterate the value of having voices on aging. I think that speaks to what was coming up there towards the end, that we need to be paying attention to each other and to our diversity and to the places where we intersect. I'm delighted that our presenters were able to share the information that they did, and I'm delighted that there were some legislators and legislative aides that were hearing what was shared and seem to think that bears expanding access to. So we've mentioned that the recordings of all the webinars will be available on our website probably by the end of the week. I'm seeing here that Phil Cernanek, one of our board members, I didn't know this, Phil, thank you, but everybody has the option to save the chat. The 3 dots at the top right of the screen where you enter a chat entry, if you click on the 3 dots, saving the chat actually, so you can take those resources with you as an option. I'm not
seeing that, but okay.
Yeah, I think I know what she's talking about. If you have a chat like I do, at the bottom, after you see everybody's comments, and you got your opportunity to speak, where it says to everyone or a person, type your message here. To the right of that, there's a button for file, but to the right of that, there's also a button with 3 dots. And if you just click on that,
yeah, there's a save chat.
Yeah, it comes up and it says, the first thing on it, it says save chat.
Mm-hmm.
And then you just click that and it should save everything, right? Or you'll get a notice on your desktop that you've got a file saved.
Okay, that's good.
Always learning something new.
Yeah, well, that's what we like to do, learn something new. Speaking of something new, our sponsor for these events is Relay Colorado, which is focused on helping people who are hearing impaired. And so I have a 30-second video that I'd like to show, and then we'll come back and wrap things up. So I'm going to do that right now. So please watch. Okay. So that's our version of a commercial. So Nothing like the Super Bowl commercials, but very helpful information. Kelly, anything else you'd like to say, Rich, before we wrap up?
I am good.
Please, please, please fill out the evaluation.
Yeah, it's in the chat a couple of different times. And we have also a note from Yolanda saying that within our communities, we're able to have created volunteer opportunity. English is a second language with and mostly without government funding. So it's been one of the biggest barriers to preventing our communities from having a seat at the table. And there is a lot of information available, and I'm sure that the folks from Dr. Cog would be happy to talk further about some of what's available that you may not be aware of. Okay, well, Kelly?
Oh, you know what? I did see a request that we share the presenters' names and contact information with people, and that will be very easy for us to do. We'll do a follow-up email. We're doing them anyway, and we will share that with people. I'm sure the presenters would be delighted to hear from anyone.
Okay. Once again, thanks everybody for your participation. Those of you who are presenting and pitching in with questions and comments and just listening in. So thank you very much.